Afternoon, everyone. I'm here to talk to you about national health insurance, but specifically the impact of population aging and decline and how that impacts the economic factors and how that will actually impact the cost and also the funding of NHI. Okay, so what is NHI? NHI aims to set up a centralized fund that will purchase healthcare services and provide comprehensive healthcare coverage to all citizens free of charge. That's the idea anyway. The current health budget is about 272 billion rand, and there's been a few calculations that's gone around, but generally NHI requires about 600 billion rand to operate. And the government wishes, well, that's what they've been talking about, is to raise a special earmarked tax to fund the NHI. So just to give you a little bit, I know Louis did quite a good job providing you the history of how NHI evolved, so I'm just going to go through this very quickly. So the NHI bill, this more recently now, was passed by the National Assembly in June 2023 and was also passed by the National Council of Provinces in December 2023, and then so the only thing that's awaiting the implementation of this bill is the President just needs to sign it into law. But once he does that, there's still quite a lot of work to be done. So we're looking at probably 10 years to full implementation. That's assuming we have the funding to actually do it. Let's go. Okay. So let's just move on to population aging and decline. I'm actually going to spend quite a bit on this section, which is quite and I don't really hear anyone else talking about this, and it's actually quite a massive impact, not just here in South Africa, but globally, in terms of how that will impact economies and funding for all kinds of services, retirement and healthcare services in the future. So I believe in South Africa, certainly, population aging will have a significant impact on the cost and the funding of NHI. Just maybe many of you don't know, but South Africa is one of the fastest aging populations in Africa, in fact in the world, and will actually enter into population decline by the end of the century. That means we hit a peak before the end of the century and then start declining. And at the same time, as that population starts the growth of the population starts slowing, the population starts aging as well. So you have a very significant aging of that population. So here's some numbers. The current population is about 61, 62 million, depends on where you get your data from. Let me just, okay, there we go. So currently about 61, 62 million people. That increases to about 76.7 million people around about 2075, and then it starts tapering off to 74.6 million people. And the main reason for that is the falling birth rates, the falling fertility rates. So currently, we're sitting at about 2.3 fertility rate. That means births per number of women in the country. And we need at least 2.3 births per female in the country, just to sustain our population, just so that it doesn't go down in the long run. Okay, so we already, I think this was last year, the 2.3 was actually 2023, so we're probably already below the point of where we can actually replace our population. So that's why you're seeing all these it's a long-term thing, but in the context of the history of a country, to go into population decline over 100 years is actually nothing, and it's a big issue. How do we deal with that going forward? So I just wanted to share some numbers in other countries. I'll go through the different parts of the world. So in Africa, you see there's still very strong growing populations like Nigeria, Ethiopia, Egypt, DRC, very strong growing populations. In fact, all of them are still growing, and most of them are doubling over the next 75 years for the rest of the century. But you see South Africa is a little bit of an anomaly there, where it does grow a little bit, but then it starts going to decline before the end of the century. Oh, sorry, you didn't. Sorry about that. So the numbers for Africa. Let me just let you have a look for a moment. So these are all, these numbers are all in millions, right? Just so you know. Okay, so let's go to Europe. So Europe's quite interesting. So UK still seems to be maintaining it fairly well, but although their growth rates are slowing down quite a bit. But you'll see in most of the other countries in Europe, in fact all of the other countries in Europe, quite significant population decline. And as I said, at the same time, the population that's at 2,100 versus current is going to be much, much older as well. You look at Asia. Asia's a very interesting area, particularly China. China's got about 1.4 billion people currently, and they declined to 766 million by the end of the century. I mean, that's hugely significant. They're the second largest economy in the world, and they're just going to run out of people to do jobs. They're just not going to have enough people to fulfill the jobs that they need to actually maintain the economy. Because if you don't have enough people, you're going to have you need people to produce. If you don't have people to produce, your GDP just doesn't grow. So they got a huge problem. I mean, there's currently in China, there's whole cities just standing completely empty, no buildings. I mean, there's all these buildings, but no people to fill these buildings. It's like a really weird situation. So that's quite interesting. India's following more or less the same kind of pattern that South Africa is following. So they do grow, but then they start going to decline before the end of the century. And then you see countries like Japan and Korea, like really challenging situation where their population, like Japan goes from 123 million to 73 million by the end of the century. And South Korea goes from like 51.8 to 24.1 million. I mean, that's like more than half gone by the end of the century. So it's, you know, how these people are going to maintain their economies, it's going to be really interesting. I mean, my thinking is, obviously it's very simplistic, but you know, as you have less and less people to do the job, the demand for labor in those countries will obviously go up. You have labor inflation, so the cost of production will be higher. I mean, even with AI, it's still going to be difficult to sustain. So then production will probably go elsewhere, you know, where there's still a lot of population, if it's able to. So there'll be kind of a shake-up over the next 100 years within all these countries, I think. Central and South America, they generally all go into decline as well, quite interestingly. So all of them go, some of them increase and then go into decline, but certainly from the peak, they all go into decline by the end of the century. And USA, Canada, Australia, I thought this was quite interesting. So they don't actually go into decline, none of these countries. I would have thought these first all countries would actually go into decline because they're older, you know. Generally you would think that they are older. But their growth rates in terms of population does slow down quite a bit, but they don't actually go into decline. And I think one of the reasons I can think of is that they've got very strong immigration policies. They attract really highly skilled professional people, young people who have kids, and that's probably why. Well, I don't know about America. I mean, they're going through a tough time in terms of their open borders. But you know, this is just historically looking at this. Yeah, they've had very strong immigration policies that attracts really young and skilled people into their country. So it maintains the production and it maintains the population in some way. If you look at South Africa, just looking at the changing demographics, we currently have about 36.7, whoops, sorry about that one. Sorry, there's USA, Canada, Australia. You'll see that they don't actually go into decline by the end of the century. Okay. If you look at South Africa's changing demographics, so currently we have about 36.7% of people below age 19 and only 5.9% in retirement or above 65. But this changes quite a lot. So it changes to like 15.9% of the people will be above age 65 in 2100. So that's quite a shift. The population, the working age population, which is 20 to 64 more or less, does increase a little bit, but also goes into decline. So it generally follows the total population trend over the century. But the average age increases quite a bit, almost by 10 years from now to over the next 75 years. So that increases by about 10 years. So that's going to have quite a significant impact on the cost side of healthcare, right? Because as the population ages, the cost per person increases significantly. So this is quite an interesting thing. So as I said, I haven't heard many people talk about it, but it's something we haven't experienced well, not in modern history. We haven't experienced population decline. We actually went through quite a significant population growth after World War II, and so it was quite easy to implement social programs when there's not many people in retirement. A lot of people, and most of the people are working. Then it's quite easy to keep the GDP going, the growth rates going, and to provide social benefits. But it's not really possible when you're going into population decline and the population aging, particularly on NHI, because you're also covering healthcare costs. So what does an aging and declining population mean for healthcare services and workers? So healthcare utilization increases with age. As the population ages, the demand for healthcare services will increase significantly. And at the same time, the working age population will be shrinking. So that means the demand for healthcare workers will tend to increase more than average labor demand, because you've got the utilization, so the need for them will increase as the population ages, right? So it's not just comparing it to the regular workers. So that means, but this is a global phenomenon, right? So healthcare workers, the demand for healthcare workers, the demand for labor, skilled labor is going to increase around the world. So countries that can pay for healthcare workers will pay more because there's a demand for them, and they want to, currently in America, for example, one of the main reasons we have inflation there is because of labor demand. And so labor demand has made this inflation very, very sticky around the world. And they've got more jobs there to fill than there are people available. So then to ensure that you maintain or you retain your staff, you have to pay them more, and that's what pushes up the labor demand. So this is going to happen worldwide because the population around the world is aging and declining. And so your demand for healthcare workers around the world is going to increase. And so it's going to be very tough to retain our healthcare workers in this country in the future unless we pay them. If we don't pay them, they're going to leave. So this places pressure on the cost side of NHI, because we need to pay them. It means it's going to cost more to run NHI. So we talked about healthcare costs increases with age. So for a predefined basket of services, the cost will actually increase in excess of medical inflation. And let me explain this, because if you just apply a healthcare cost curve, so healthcare cost increases with age, if you just apply it to the future demographics in the country, you can calculate what the excess increase would be over and above medical inflation because of the changing demographics, the age increase. And this is about between 1% and 2% in addition to medical inflation. So that means if medical inflation is running at, say, 5%, the total cost increase, and this is every single year, is going to be 6 to 7%. And if you don't have that, you're just not going to be able to meet the basket of goods that you put aside for the population. So, and then I said before, you need to pay, so the 5% is what you're paying the person for his services every year, right? So he's getting 500 Rand, a doctor's getting 500 Rand a visit. Next year you have to increase it by 5%, and you need to increase it a lot because you need to maintain those healthcare professionals, otherwise they're going to go elsewhere. So there's a lot of pressure on the cost side of NHI. So firstly from an aging population, and secondly from trying to maintain these healthcare workers in the country. Okay, so the government wishes to fund the NHI through a special earmarked tax on citizens, right? So that's what there's been a lot of talk about that. And we already know that the costs are the costs of NHI is going to increase at least 1 to 2% above medical inflation every year because of the aging population. There's a curve called the Laffer curve, you mentioned it, that basically plots on the x-axis the tax rates and on the y-axis the total tax revenue. And I mean, this is very simplistic, but generally, as you increase your tax rates, you will increase your total tax revenues. But at a certain point, your total tax revenues will actually reduce when you increase your tax rates further. And the reason for this is because let me just go into the next slide. The reason for this is because you're really stifling consumer spending. If you stifle consumer spending because of the higher tax rate, if your take-home pay gets less, you're not going to spend as much, right? So at a certain point, your consumer spending starts going down, so GDP starts going down, and hence there's lower job creation as a result. So, and my feeling is we're already there. Okay, we might even be past that point already. So if we increase the tax rates more, we're probably going to, dampen the GDP growth even more, and probably end up with higher unemployment, lower GDP growth, lower total tax revenues. So we're already in that very difficult situation. Just to give you an idea of just so that you can look at some numbers, 94 to 2012, average GDP growth was about 3.2%. Over the last 10 years, it was around about 0.9%, so significantly lower. And it was also during this period that personal income taxes, particularly the high-end marginal tax brackets taxes were actually increased quite significantly to 45%, and VAT was also increased by 1%. So it's quite interesting that the GDP actually went down quite a bit, the average GDP during the time. I'm not saying that there might have been a lot of other reasons why GDP growth is down, load shedding for one, I suppose, but it does seem it did happen during the same period, so it might be that increasing taxes had an adverse impact on GDP growth during that period. And it also seems that Treasury is exercising quite a lot of restraint in terms of making money available for NHI. I mean, you talked about 1.4 billion. I think somewhere around there that in this new tax year that they're going to make available, but that's nothing. That's a drop in the ocean. I mean, it's like, I don't know, it's like it's just not going to get anywhere. So basically it's unclear how we're going to fund NHI going forward. So there's other factors that impact GDP growth. I just want to go through that as well. And this is from the labor stats from December 2023. So the number of people of working age is about 41 million people. Number of people that are formally or informally employed is about 16.7. There's a number of people unemployed of 7.9. And then there's a group that are discouraged or not economically active, that's 6.4 million people. So the employment rate, which is basically the number of people working divided by the total number of people that can work, is 40.7%, which is really, really low. Compared to most other countries in the world, it's really, really low. And so I just want to show you some of the other countries where we kind of measure up to. So we have probably one of the lowest employment rates in the world. Okay, so countries like Switzerland, Netherlands, like low 80s, even Nigeria is at 75.6% employment rate. United States at a 60.3%. And we are down there at 40.7%. So if we had to increase our employment rate significantly, obviously that would contribute to increasing our GDP, total tax revenues, which will help obviously fund NHI if we're able to. The other thing that's also quite interesting, which is also going to create a lot of pressure on the GDP and collecting taxes in the future. So SARS IRP5 data about 6-7 years ago indicated that about 6.8 million people were actually contributing to a retirement fund. And this translates to less than 20% of the working age population. So that 41 million people that can work, it's less than 20% of them, okay? Actually contribute to. So what's concerning is that more than 80% of the people in working age population are going to enter into retirement in the next 30, 40 years with zero savings. And so they're not going to contribute to the GDP or taxation in this country in the future. Very difficult. The other concerning thing is Sanlam did a survey 2021 to work out just to get a sense of what replacement ratios are. So the replacement ratio is what you earn in retirement, or what your income is in retirement, versus your final salary before you go into retirement. And their measurement was 25 to 30%. So the people that are going into retirement only have about 25 to 30% of what they used to earn when they were working. So that's another concern. So even the people that aren't that do have savings don't have that much savings, which is a concern. So this is going to just put a lot of strain on our GDP going forward. It might not happen like this year, next year, but over time, as I said, 100 years in a country's history is like nothing, and these are the things that are probably going to start creeping up in the years to come. And, if you're implementing a massive social program like NHI, you have to think 100, 200 years ahead, because you can't just put it in place and then 10 years say, oh, it's not working, right? You have to look at it very long term to see if it's actually going to make any sense. So my conclusion is, the cost component of NHI is likely to increase in excess of medical inflation. This is due to expected sustained demand in healthcare workers globally, so it pushes up that inflation. Plus, you got the impact of the aging and declining population, which means that your costs will increase in excess of inflation. And we're also unlikely to meet the funding requirements of NHI because it requires sustained long-term growth in GDP and total taxation. And the budget is increasing by 1 to 2% above medical inflation. So I just can't see that. I see it's very unlikely to happen, particularly if more than 80% of the people retiring one day just don't have any savings. So where's the money going to come? Where's the consumer spending going to come from in the future, right? And the proportion of people that are going to be in retirement in the future is just increasing because of the aging population. You've got less and less people of working age. So given that, oops, I don't know why that's like that. Anyway. So I guess my recommendations is we need to work with the existing health budget, and even that's going to become challenging, to grow that health budget in the future. But we currently have a health budget. At least we have that on the table. So we need to work within that and do the best we can within that. I don't see there being any room to fund a lot more than that than we currently have. In fact, I think that's going to be even challenging as we move into the future. We need to increase employment. Sorry for the mix-up in this. Different I don't know why that happened. Anyway, we need to increase employment, okay? So it really appears that I showed you from the earlier slides, we got one of the lowest employment rates in the world. It could be our education policies, labor policies. Certainly it seems that our labor and education, I'm not an expert in that, but it certainly seems that those aren't working. At least the stats are showing that our unemployment rates are very, very high. And we need to review other mechanisms quite urgently to try and get our employment rates up. That would be, that's what we need to do. Because it seems like we're just creating this vulnerable group of people that's just increasing all the time, and then they just don't have the skills required to be employed. And these individuals will continue to be a burden on the state as we go along. And I don't know where the state's going to get the money even to fund, to help these people. But anyway, but these trends are quite concerning, which is very specific to South Africa. And it makes, population aging declines already a problem. So to have that on top of aging population in decline, it's, you know, it just exacerbates the problem. Okay. So one of the other things we can do, we can increase foreign investment, although we haven't been very good at that. Foreign investment helps to stimulate the economy, creates jobs, increases GDP and tax revenues. And there's also a transfer of skills and technology, you know, which is highly beneficial for our country. Again, it appears that our policies aren't attracting foreign investment, and well, it's, you know, it can be improved quite significantly. And I showed you the slide earlier on where you saw all the African countries where they actually go into massive population growth as we go into the future, where South Africa is actually going to decline. So if you're a company, if you're a foreign company and you want to invest in a country, you're going to see, well, which country is going to have growth, which country is going to have increasing consumers that can actually buy my product, etc. Okay, where South Africa is actually going to decline, might not be the best place, you know, to invest. I mean, you do look at other factors, of course, ease of doing business, logistics, you know, everything, transport systems, etc. But yeah, so we're going to be basically competing in the future against countries with strong growth, strong consumer growth in the consumer base, and our consumer base is basically shrinking. So it's been very tough to, you know, I think we need to really step up. I mean, I don't think we have an attractive policy as it is, so we're going to need to really do a lot more to get foreign investment into this country. So here's an interesting thing. I just did some calculations just to look at, well, what happens if we increase the retirement age? And maybe some of you might have mixed feelings about this. But if you had to increase the retirement age to, say, 70 instead of 65, so you're just working for an extra 5 years, you're contributing to your pension fund an extra 5 years, you basically get double the amount of retirement income when you retire. Okay, which is very significant. So that will have a very significant impact on GDP, you know, consumer spending, obviously, and the ability to fund the NHI. And the impact's actually twofold. So while you're working, say you don't retire at 65, but you work till you're 70, while you're working, you're also earning a lot more than you would when you're in retirement. So during that period, you're also contributing to the consumer spending and the GDP and the taxation of the country a lot more. So that's quite significant, you know. I mean, you know, if maybe some people feel they got enough retirement money and they don't need to retire, they can retire at 65. Some people feel they don't have enough, right? So maybe it's a good thing that they might consider increasing the retirement age to 70. So the other thing about people being active, oops, let's go there. Yeah, there we go. So the other thing about people being active while they're working, they tend to be more active, etc., and their healthcare costs tend to be lower than when they're actually in retirement, even for the same age. So that also helps to reduce the cost of financing the NHI as well. So that's all of these things will actually be a very positive spin-off on if we were to fund NHI. Impact on medical schemes, I think it was mentioned earlier. Let's go there. So the idea of NHI is to, once they reach full implementation over time, or even during that time, whatever benefits they offer, medical schemes aren't allowed to offer, right? It will be completely outlawed. And so eventually the idea is once they reach full implementation, medical schemes would only be able to offer whatever they don't offer, right? So it's probably going to be very little. I mean, that's when we're talking about assuming NHI will be implemented, which we know it can't. So the issue I have with this is that they're creating this narrative that medical schemes are going to be out, you know, basically phased out, but it's irrational because they're never going to be able to do NHI in the future. So, but that's a problem because it creates uncertainty in the market. It reduces, people are more reluctant to invest in the economy, invest in healthcare, and it just doesn't. It's very counterproductive. It's irrational, in my opinion, and they need to stop that. So, but even if NHI was viable, you know, medical schemes should still be able to offer, should still be able to compete against NHI, I think, okay, because that will help. So competition helps to increase the level of care, and efficiencies in service levels, patient outcomes, as well as cost. So it's really, why wouldn't you want that? Why wouldn't you want competition? It doesn't make any sense, you know. Because I mean, imagine there's only one medical scheme that provides services, or one fund that provides services. I mean, who's going to check that they're provided properly? You know, who's going to check those service levels and make sure the level of care is properly, etc. There's nothing to, I mean, there's measurements, but there's no competition to drive those outcomes in any way. You know, so I think that's irrational as well. Anyway, that's the end of my presentation. Thank you for your attention. Appreciate it.